I'm now going to introduce to you the general overall musculoskeletal exam sequence. Now this is a uniform exam sequence that we can utilize to assess every individual body part of the body. So let's start at the top. Patient interview. This is our subjective exam, and we want to gather all of the subjective information possible from our patient. We want to know the mechanism of injury, the behavior of symptoms, the nature of the condition. We want to find our patient's concordant sign, find out what time of day is better for them in terms of pain, and if anything makes the pain better or worse. We then want to move on to observation. This is where we want to observe our patient from head to toe. Is there forward head, rounded shoulders, and excessive kyphosis? A hyporlordotic lumbar spine? Is the pelvis anteriorly tilted or posteriorly tilted? Are the hips in retroversion or anteversion? So a complete observation is warranted here. We then want to move on to functional testing and screening. This is where you can have your patient walk around, perform deep squats, unilateral stance, or any functional measure that you think is necessary. If the patient reports any radicular pain, referred pain, or possibly myelopathic symptoms, we want to perform a thorough upper quarter screen here. We then want to move on to active range of motion, passive range of motion, and passive accessory motion. Now this is your full exam, and want to perform all of your examination techniques that we'll demonstrate in our individual exam schemes. We then want to move on to palpation. This is a specific palpation technique used for each individual body region and should be appropriate to the region that you are assessing. We then want to move on to manual muscle testing, and again test only those muscles that you feel should be compromised or possibly could influence the patient's condition. Special tests. Special tests at the end should be your specific special tests. Your specific special tests, as we'll review in our sensitivity and specificity video, are those that can rule in a condition. So here we're ruling in a condition at the end and ruling out a condition here during the screening exam. And that's the general musculoskeletal exam sequence that we'll be utilizing throughout all of our videos.